Good evening, everyone. Welcome to the Specialty Nursing Certificates Virtual Information Session. Thank you for participating in the poll. It looks like we have a variety of interest in all three programs that we're going to cover tonight, so that's excellent. And I'll just open up now to our agenda. So I'm going to introduce the panel members that we have with us today. And then for each of the three programs, we're going to run through a variety of details, anywhere from the rewards of the program, is this career right for you, giving a program overview, and then a review of the different program modules, so all the different components of the program. And then we'll cover admission and program requirements, as well as employment opportunities and the next steps. So you have an opportunity to ask questions throughout, or you can always ask questions at the end. We ask you to use the Q&A box, I call it. If you click on the Q&A bubbles, you can type in your question there, and it's easy for Christy to answer the questions while Jim and I are presenting, and then for me to answer questions while Christy's presenting. And we are covering the LPN Orthopedic certificate, as well as the PeriAnesthesia nursing and the gastroenterology nursing. So my name is Cindy Meisner, and I'm a program administrator and your co-host for this evening. I've been at Okanagan College for 24 years and involved in a variety of health programs. Also with me is my colleague, Christy Gels, who is a program coordinator and my co-host this evening, who also coordinates different health programming. I'm really pleased to have Jim Fishley here. He's one of our developers and instructors for the LPN Orthopedic certificate. And it's great to have somebody from industry here to talk about what that type of career is like. So this is a quick bio on Jim. Jim has been a nurse for over 28 years and an orthopedic tech for over 20 years. He's currently at Vernon Jubilee Hospital, but he's also worked at Kelowna General, and he primarily works out of the emergency department. And Jim, as you'll find, is a very passionate fellow, and he has felt there are many rewards to his career, and he really enjoys that it allows him the ability to provide the best quality service as an orthopedic technician. And he looks forward to embarking on this journey with the different students that enroll in the LPN Orthopedic certificate as an instructor and a program developer. So I'll let Jim talk a little bit more about the rewards of an LPN orthopedic technician. Go ahead and unmute yourself there, Jim.
Okay, hi, I'm Jim. And yeah, like Cindy says, I've been an ortho tech for over 22 years, and yeah, it's amazing. So this course that we're offering here, it's a fast pace, it's a specialized career choice. You have to ask yourself, are you right for the program? And if you're a strong problem solver, if you like to engage in critical thinking and your skills are high, and you know how to find relevant information to get the jobs done, then it's you. You work autonomously, so you have to be able to do that, even though you are working with the orthopedic surgeons and the emergency physicians all the time. You are still, they're coming and asking you, your opinions and what, so you're highly recognized. You do a lot of one-to-one on patients, of course, and then you're basically on your feet the whole shift. It's very physically demanding. You're working over the patients, doing dressings, splints, casts, whatnot. You need to be physically fit as well for procedures like counter traction for wrists, shoulders, hips. Putting hips in is quite rigorous to be able to hold the patient down and whatnot. And that We ask that you have a strong practical nursing background in knowledge of human anatomy and physiology, primarily, knowing all the muscles of the origins, insertions, their actions, the bony landmarks, bone growth, development, and maintenance, and then all the neurovascular structures as well. It's with this course, it's very important too that you have a basic computer knowledge, skills for Microsoft and how to upload documents and do online platforms. There are always tutorials on how to do these things, so that if you are kind of learning at that level, that you're not going to be lost to it, and we can always help with that as well. There's a few employment opportunities with as an orthotech. You can work in either the orthopedic or the plastic clinics. We work alongside the orthopedic surgeons, the plastic surgeons, and either applying and reapplying the splints and casts, and then the dressings associated with that. You can also work in the minor treatment areas of the emergency departments, where you see a vast amount of a variety of patients of all ages and all variety of injuries. It's there in the emergency department. You can also be asked to join in the trauma room as well and participate and bring your skills with orthopedic procedures from either multiple motor vehicle accidents and or whatever. So it's a great opportunity to really show your skills, to be a vital part, to be really, there's not a lot of us in BC at all. And it's exciting, and like I said, you're highly recognized as well. So it's a great opportunity, and this course is quite rigorous in the fact that there's a lot of information being offered. We kind of start off with an orthopedic preparation development course that we're basically building on your knowledge base from an LPN, and just kind of giving you some more information on human anatomy and medical terminology to kind of get you ready for it. And it's really quite a short little program that we get into when we're looking at into the Orthopedics 110, which is the anatomy and physiology. And in that course, we're concentrating on all the bones, muscles, ligaments, tendons, associated nerves and circulation, and how these all relate to each other. And it's basically the meat and potatoes of this program. So getting a really good knowledge base is imperative to be able to become a really good orthopedic technician and help the patient, and also to be able to communicate with the doctors and then in turn communicate with the patients. In Ortho 111, that is the pathophysiology part. It's a bit longer of a topic. Again, it's another meat and potatoes part of it. And there we're learning to understand the pathology, diagnosis, and treatment of orthopedic conditions and disease processes relating to all both like pediatric, adult, and geriatric patients alike. Ortho 112 is the specialty skills program, and in here we're utilizing the information we've learned in 110 and 111. And then learning how to use that to complete our orthopedic assessments and management of orthopedic conditions. We also have an introduction in this part in 112 for splints, casts, traction, and other orthopedic devices and how their applications are used, and also associated wound care that goes along with that. In Orthopedic 113, the practicum preparation part of the course, we're again utilizing the information we've learned in 110 and 111, and that we're looking to identify x-rays and their common orthopedic fractures, so honing that skill, and then looking at application techniques of splinting, casting, traction, and other orthopedic devices, and how they are specifically to be applied and the reasons behind that. We also look at the patient's need for ambulations post injury, what are their needs, and then teaching them how to be able to use them. We're also talking about patient teaching, whether it be cast care or wound care, or just their basic, how do they go along and rehab themselves, and exactly are they understanding what the doctors are saying to them as well. in 113, we're also looking at wound care and then the possible associated complications with that, and recognizing what is the appropriate device, whether it be a splint, cast, or whatever, to be placed on top of these. The doctor may say one thing, but it's still up to us. We still need to know what we're putting on and why we're putting it on. We get into the practicum, the 114, and that's basically a 260-hour practicum, and where you'll either be in probably both in the orthopedic clinic and then partially in your minor treatment area as well, and learning how to work in there and to problem solve, to assess the patients properly, to see what diagnoses are needing to be done, to be able to communicate with your doctor, to be able to get the proper skills done and treat the patient. So yeah, I'm really hoping you guys are interested in this. It's a fabulous career choice. So
awesome. Thanks, Jim.
thank you.
So the next intake that we have for the LPN Orthopedic certificate is coming up at the end of June. And it is an accelerated program, so it is going to be offered on a full-time format. So it'll definitely be highly intensive. And so the dates will go June 27th to September 9th, and then the lengthy practicum that Jim mentioned. So the tuition for the program is $7,772, and it is possible to break that into 2 different payments. All of the texts and materials are provided to you online as resources, so there's no additional costs for those. And how we deliver the program, it's all online. It's what we call asynchronous. So you're working at your own pace. There will be assignments, there will be exams, and so there are certain measurements that you have to meet along the way. And that's all laid out for you in each course that Jim mentioned. And then of course your practicum is done face-to-face within a health authority location that's available during that time. Our next intake that we intend to offer LPN Orthopedic is in January. And we're just looking at the health authorities to see if they would like that to be offered in a part-time format or an accelerated full-time format like we're offering this time. So we'll have more information on the intake details in the coming weeks. And I think at this point, what I'll do, the rewards, Jim kind of touched on those a little bit, but it's about building relationships with the patients and staff, and you're helping people and you're providing that compassionate care. It's definitely a very interesting position, and with the casting and the splinting techniques and using the different devices. So it's definitely a good opportunity for people, and there seems to be a lot of need in our health region throughout the province. So for admission requirements, all of this information is available on our website, but just to kind of touch on it, we confirm with the registry for your active practicing license as an LPN. Then what we ask you to provide is a proof of minimum 2 years of full-time equivalent acute care experience, and it needs to be acute care. You need to provide proof of your wound care competencies, and there's different I-learns through Interior Health, or there's other equivalents that I can provide to you if you're wondering about that. And then also you need to keep your CPR level C current, and then have your either your Red Cross or St. John ambulance standard first aid. And criminal record check is required for this program, and information is sent out once you're actually admitted into the program. As well, the tuberculin testing can only be done 6 months out. Obviously, we're at that point when the program's starting so quickly. And then for a January intake anytime in June. And then all the different immunizations are listed as well on our website. I don't expect you to be able to read the slide, so you can get more information there. And I think at this point, what we'll do is we'll take some questions. If anybody has any questions for Jim, that way Jim doesn't have to stay throughout the entire information session. So if anybody has a question, they can turn on their mic and ask it live, or you can put your question in the Q&A bubble, and we'll read that out and hopefully help you with whatever questions you may have. And we'll just give everybody about a minute. And I think in the meantime, I will do my second poll question. We're just wanting to find out where everybody resides. So what area, what health region you live in. And it just helps us to be able to facilitate what your needs are. And I see that we have some from Interior Health, some from Island Health, Fraser Health, Northern Health, and other. So that's excellent. Awesome. Thank you for participating. Okay. It doesn't sound like we have any other questions. So I guess, Jim, you can leave at any point that you wish. Thank you so much for being with us here tonight. I know you have a super busy schedule, and we appreciate you being here, and we will talk to you soon.
Hey, thank you very much for this time.
Thanks,
Awesome.
Jim.
Okay.
So next up we have Christy. Oh, there's a question there. Do we offer this program to nurses outside Canada? Christy, have you come up with that question before?
I have come with that question before, and yes, absolutely we would, but the issue isn't whether or not you can take the program. The issue is whether or not the program is recognized in your region. So that's something that you really need to talk to your governing body or the hospital or your supervisor about if you're living outside of Canada.
And if maybe we didn't answer that entirely, then please ask us again and we'll follow up with that. So next I'll ask Christy to talk about PAR and GNC, and then I will manage the Q&A box. So go ahead, Christy.
Thanks, Cindy. So I'm Christy Gels. I'm the program coordinator for the PeriAnesthesia and the Gastroenterology nursing certificates at Okanagan College. We've offered them both for a few years now. They're both offered on a part-time basis through distance education at the college. They're offered asynchronously, just like the LPN program is, with a face-to-face practicum. So if you want to be a PeriAnesthesia or GNC specialty nurse, then you do need to have a strong attention to detail and critical thinking skills, which I think most nurses already do, thorough and highly responsive, and then you need to have a good background in human anatomy and physiology. And the course is fast-paced and intensive, and you have to be prepared to be, generally speaking, in our evaluations, most nurses find that depending on the module, you are looking at spending between 7 and 12 hours a week during this program before you get into your practicum. And Cindy, I don't have control of the slides, so could you go to the next one, please? So this is just a high-level overview of the PeriAnesthesia program. We have 10 modules, and the practicum is the longest one. It's 6 weeks long for this program. It's fairly self-explanatory with the titles. PeriAnesthesia nursing, of course, is the introduction. And we look at respiratory, cardiovascular, and neurological care, general and versus regional anesthesia, admissions and discharge, pain management, post-operative complications, and specialty populations. So we're looking at the elderly and children in that one. Cindy, can we go to the next slide? The program itself starts on September 6th of 2022 and will run through the theory portion of the program. until April 14th, 2023. Now, the PeriAnesthesia program is a little bit different than most of our programs because you can actually start your practicum before the theory ends. So following the module PAR 107, you can actually start your practicum. Now that's going to be up to you and your nursing manager or your supervisor as to whether or not you're going to do that. Some hospitals and departments really appreciate that you can start your practicum prior to the end of the program, and some would rather have you complete the theory before you do. And we're really flexible with that. The tuition is $7,650. And like Cindy said, for LPN Ortho, that is, you can make those in 2 payments. The textbook is ordered off of Amazon. It's about $120. I already spoke about the delivery, so we can go to the next slide. Thanks, Cindy. So we already looked at this. It's the same program requirements as the LPN Ortho. So essentially all of your vaccinations and then the negative results of a TB test. And the next slide, please, Cindy. So the gastroenterology nursing program, this is the outline for that one. Gastro is a really good program. We've been running this program for 8 years now. And it allows sorry, I was looking at a question. Sorry. It allows for you to move into a different program or a different line of work for both LPNs and RNs. This one is available for both, whereas PeriAnesthesia is only available for RNs. And generally speaking, gastroenterology clinics are usually not necessarily a 9 to 5, but a more business hours scenarios. So that scenario allows for nurses to move into a slightly less harrowing schedule, I suppose. It's also a 10-month program. And the practicum for this program is 3 weeks long, or 105 hours. Can we go to the next slide, please? Thanks. So here's a quick schedule of that one. So this one would run from September 12th to June 9th of 2023 plus practicum. Not with this practicum, you have to complete all of the theory before you can go into the practicum. The tuition is $6,469, also available for 2 payments. Gastro, the text for gastroenterology nursing is a core curriculum 6th edition, as you can see on the slide. It is available through SGNA, which is the Gastroenterology Nursing Association of the United States, and it's $220 for that book. Now, if you become a member of that association, I believe that the price is slightly cheaper. Now, this program also online, asynchronous, and the practicum is, of course, face-to-face. Can we go to the next slide, Sin? So for gastroenterology nursing, just like LPN Ortho, you have to have an active practicing license from your province, proof of a minimum of 2 years of full-time or equivalent experience of acute care, current CPR level C, and a written, and this goes for both the PeriAnesthesia and the gastroenterology program, you need to provide a written agreement of practicum placement from your PeriAnesthesia manager in the case of PAR, and in the case of GNC, the gastroenterology manager. With gastro, it's a little bit different because you also have an observation day that needs to be done after the 2nd module, and that one is for sterilization. So you need to be present in a meter, a medical device reprocessing lab, for you to be able to observe that and how that works. And then, of course, a criminal record check as well. Can we go to the next slide, Sin? Again, same program requirements. We can go to the next one. So next steps are to apply. If you're interested in the program, my recommendation, and I would assume Cindy would say the same thing, apply earlier rather than later so that you can secure a seat. We know that the healthcare industry has been incredibly busy over the last couple of years. And we also know that they are looking for specialty nurses. Really appreciate you all being here. And I'm going to go into the chat and see if there's any questions I can answer. And those have all been answers. Done a great job, Cindy. Thank you.
So Christy, there is one in the chat, and I can't speak for your courses about practicums. Rose is asking, do we have to organize our own practicum sites?
So for perianesthesia and gastroenterology, yes, you have to organize your own practicum sites. That's one of the admission requirements. You have to have a practicum site signed off by a manager as a prerequisite. So we need a letter saying, yes, Rose could do her practicum at our facility.
And then for LPN Orthopedic, we actually request the practicums through HSPNet, so that we work with you in order to secure your practicum location, but it's not something that you actually do on your own. So it's similar but different.
And to answer Valerie's question, the course isn't necessarily required to work in a PACU. It depends on the PACU. It depends on your health authority. So you would have to inquire with the PACU to see if this course is something that you require, or if it's something that you should be working on while you're working in that PACU.
So, and for those maybe not looking at the question and answer box, Valerie was asking, is the PAR certificate required to work in PACU?
Thanks, Cindy. Bhupinder, you're asking if you're not working in acute care, can you still get in GNC? So one of the prerequisites is to have 2 years of acute care experience for you to get into the GNC program. However, if your employer is wanting you to get into the GNC program for your employment, then I have had experience that the director will sign off on a prereq waiver for that, because generally the 2 years of acute care experience is something that the employer wants. It's not something that we as Okanagan College necessarily needs, but that's what the employer wants across the board. And that when we researched the program and developed it, that's what employers and health authorities were looking for.
And before we go to the next question, our last slide just talks about different people that you can contact. So both Christy's and my emails are there. And then also our admissions clerk, Leslie Stevenson, her email is there as well. So if you want to jot those down, go for it. And I'll take the next question. Sharon's asking, will PAR be offered in January as well?
No, it's only being offered in September at this time.
And then Bhupinder said, I am working in long-term care versus acute. So
Bhupinder, I would encourage you to reach out to me via email, and my email address is on there, and we can talk about that and see what your options are for GNC, okay?
And then Valerie's asking, is 2 years of critical care experience or acute care for PAR?
Valerie, it's acute care for PAR, not critical care.
Great questions, everybody.
Very good questions.
You're welcome. I'm going to stop sharing now so you can at least see who you're talking to. And if you want to ask a question live, you're welcome to unmute and ask your questions. Otherwise, keep putting them in the Q&A bubble. We'll just wait one more minute.
I have to say, I love doing these info sessions for nurses, Cindy, because they have really good questions.
Yes. And I have to say, this is the most brief information session that we've done for 3 programs. I've only actually done them for individual programs, and this worked really well, and I hope it was effective for everybody that joined us.
And please, like I reiterate, please reach out to either of us or Leslie Stevenson for more information. If you get off of this Zoom call today and go, oh, I should have asked that, don't hesitate to reach out to us.
Actually, just put it in the chat. So for more info, Leslie, I'll put hers in there for sure. And I'm just going to stop the recording.